Hello everyone. Today we have with us Dr. Firuza Parikh, the famous fertility expert who has become the hope for several patients battling with infertility. Dr. Firuza, after completing her MD and MBE, was trained at Yale University School of Medicine for 4 years as postdoctoral researcher in reproductive medicine and is now the Director, Department of Assisted Reproductive Medicine and Genetics. Dr. Firuza has been on the Outlook magazine's top 15 women role models in India list and is a recipient of several other accolades. Her team was responsible for the first ICSI baby in India in the year 1994. To start with the questions, I would just like to begin with, what do you think is the current trend of infertility in India, and do you think if it is rising, and what are the possible causes for this rising of the trend?
First of all, thank you very much for having me on this program. It is an honor and a privilege, and I'm very excited about this because we'll be able to share some of the knowledge that we have with our colleagues. Infertility, as you know, cuts across all classes, creeds, religions, countries. About 8 to 12% of couples in some time of their reproductive career face infertility. And this is all across the world. Sometimes the reasons for infertility may be different in a particular geographic location. For instance, in India, pelvic factor infertility because of genital tuberculosis is very common. In the West, pelvic factor infertility because of endometriosis is common. Today, because of the all-pervasive nature of chemicals, toxins, more and more younger people and couples may face the brunt of reproductive issues because of toxins. This is something that needs to be discussed on a larger platform. But by and large, 10 to 12% of couples who are trying for a baby may face infertility. Male factor accounts for about 30 to 40% of infertility, female factor another 40%, and a mixed factor where both the female and the male may contribute is another 20%.
So seeing the trend, what were the hurdles that you faced in the co-culture IVF that led you begin with this newer approach of cumulus aided embryo transfer, that is CAT you call it?
Yeah. To put the technique of cumulus aided transfer, that is CAT, in perspective, let me give you a little bit of background about ART and IVF and ICSI. IVF started with the birth of Louis Brown in 1978. So this whole field of ART is about 38 years old. It is a young and nascent field. When IVF started, pregnancy chances or success rates were very low. Then with various techniques, innovations, scientists sitting together, working on animal models, things got better, and pregnancy rates, which were as low as 5%, started moving up to 10%, 15%. With the advent of good medication, good laboratory practices, better technology, this ups to 20%. Then there was a plateauing of pregnancy because there were people who had severe male factor who could not have children because of very low sperm count. With the advent of ICSI, intracytoplasmic sperm injection, there was a whole subset of couples facing male infertility who could now have their own biological child. This happened in 1992. This again started where what was a classical mistake. Palermo, a young scientist in Belgium, was experimenting with trying to put a couple of sperm with the help of a pipette just beneath the shell of the egg, which is known as the zona pellucida. By mistake, this fine injection pipette went a little further and penetrated the cytoplasm. Palermo thought it was the end of that egg and the egg was destroyed. He kept it very carefully in a petri dish along with the other eggs where he had tried to inseminate or inject the eggs underneath the zona. Lo and behold, that is the egg which looked fertilized the next day, because the sperm had penetrated into the heart of the egg, into the cytoplasm, and that was the birth of ICSI. There are many things that happen because of serendipity. Let me tell you a little bit about CAT, cumulus aided transfer. Usually on busy days when Rajesh, my husband, who is a neuropsychiatrist, and I don't have time during the course of the day to talk, we usually take a walk on Marine Drive to discuss ideas, talk about the family, talk about our 3 children. It was on one such evening, a later part of the evening, when we were discussing people's wants and needs and how sometimes nature doesn't allow us to waste things and how nature is so resourceful. And I was telling him about one of my students who wanted to do his PhD with me, and we started talking about the wastefulness that can be prevented in the laboratory. We started talking about cumulus cells. These are cells which we discard when we are doing the ICSI procedure. The cumulus cells are cells which surround the egg and they are part of the granulosa cells. And I started telling Rajesh that these contain a lot of growth factors and nutrition. And then he hit upon this and said, why not utilize them in IVF? Why are we discarding them? And he said, why don't you ask your PhD student, Mr. Kulkarni, to work on these cumulus cells? And that is how we started looking at these cells to see what is the extra benefit of using them. And that is how the technique of CAT was born. So it was indeed serendipity and putting our minds together and thinking out of the box that led us to offering this technique, which has upped the chances for IVF for infertile couples.
That explains a lot. So can you please elaborate the advantages of CAT from a clinician's perspective, and also what does the statistics say about its success?
So whenever one has a scientific approach, it's always good to try and look at a control group and have your test group. In the initial years, that is in 2005, we prepared 2 arms of the study. We had about 250 women who were matched for age and other indications for infertility and undergoing ICSI, who became our control group. And we had a test group of more than 500 couples where we did the CAT procedure. We found a distinct increase in the pregnancy rates and the implantation rates by about 10%. We presented this at many conferences and we sent out a publication from Jaslok Hospital to Fertility and Sterility, which is the US representative of all the IVF specialists. Fertility and Sterility is the scientific journal of ASRM, the American Society for Reproductive Medicine. This got accepted in 2006 and the picture of the cumulus cells even appeared as a front page on the cover of the issue.
So, is CAT as cost effective as other conventional methods for a patient's perspective as well as a clinician's perspective?
Right. So, CAT is a very labor intensive procedure. When we are doing ICSI, we are basically discarding the cumulus cells and we are not paying attention to the treasure that these cumulus cells hold. Because these have to be cultured, these become like a co-culture. A co-culture is a group of cells which become a feeder layer for other cells. There are many co-culture systems. People have tried fallopian epithelial cells. They have tried cells from animals which are no longer to be used because of the danger of passing on some form of infection. People have used even the cells from the uterus, endometrial cells. But the best are cumulus cells because one, they are readily available. They are from the patient herself. So there is no question of passing on any infection. They are also present in nature when fertilization occurs in nature. So cumulus co-cultured cells are very easy. They are not expensive because they come along with the egg. Only thing is the whole process is very labor intensive. It requires expertise, and once one has this expertise, it is not difficult at all.
Okay, so then there are any specific indications when a patient should be treated with CAT and not ICSI, that is intracytoplasmic sperm injection, which is a conventional method everyone uses?
So basically when we do ICSI, you always have to do ICSI for fertilization. CAT is an add-on procedure. Once the fertilization occurs, only then are the embryos exposed to the cumulus cells. So it is an add-on. It's not a separate procedure. One has to do IVF or ICSI prior to doing CAT.
So though it is an add-on, do you think there are any risk factors involved in performing CAT?
Okay, first let me give some advantages of the procedure so that we can understand what nature's bounty provides us with. The cumulus cells, and this was shown by Dr. Dhananjay Kulkarni during his PhD thesis, these cells produce a lot of integrins. They produce cytokines. They produce factors like VEGF. They produce factors like IL-6, interleukin 6. They produce cytokines. All of these are helpful to, one, get rid of many toxins. They clear up the embryos of the toxins. They make the embryos divide better. They bring about adhesion molecules like integrins, which help in the stickiness of the embryo. Implantation is basically a crosstalk between the endometrium and the embryo. This chemical crosstalk involves many cytokines and interleukins. This is exactly what the cumulus cells are secreting. There are no major disadvantages. There is one condition where cumulus cells are not used in a couple, and that is when there is autoimmunity, where the thyroid antibodies are high or the woman has ovarian antibodies, because these antibodies would also be secreted by the cumulus cells. That is when we would avoid using them in the CAT procedure.
So then are there any contraindications of CAT, and also if a patient who has infertility due to a previous ectopic pregnancy, is CAT can be done?
CAT should not preclude a doctor from being used even in the presence of a past ectopic pregnancy. There are no major contraindications to using CAT because it is a very natural procedure. When fertilization would occur in vivo in a natural circumstance, these cumulus cells would be present on the egg. In fact, in the laboratory we are removing them, we are denuding them. So in fact, when we do CAT, we are helping or enhancing the procedure by making it more natural.
Okay, so then what are the special or additional instrumentation required for an established IVF center, if there are any, to start away with the use of CAT?
So really speaking, there are no additional instrumentation that is required. The basic IVF setup is fine, but what is required is a lot of tissue culture medium, because the cumulus cells have to be cultured over 4 to 6 days. It also requires a lot of expertise because there is a particular way in which the cumulus cells have to grow. And finally, when we are ready to do the embryo transfer, we pick up a few of these cumulus cells, about 2000 to 2500 such cells, and insert the embryos along with these cells in the uterus.
So we have heard about it. So how exactly CAT is done then?
Okay, CAT, which stands for short form of cumulus aided transfer, is a part of the IVF process in our laboratory at Jaslok. What is done is, first, once the eggs are collected, they are examined by the embryologist. We make sure that these are mature eggs, what is known as M2 eggs. Then very gently with a fine denuding pipette, the cumulus cells are removed from the egg. They are kept in a separate culture, and prepared on petri dishes, so they form a feeder layer. The embryologist next proceeds with doing ICSI, intracytoplasmic sperm injection, and the next day, that is after 24 hours, the eggs are checked for fertilization. At the same time, the cumulus cells are also checked to see whether they are expanding in culture. Once it is observed that the eggs are fertilized, the eggs are now moved into the culture plate which contains the cumulus cells. Here something fantastic happens over the next 48 to 72 hours. These cumulus cells actually start projecting finger-like projections which are known as dendritic processes, and they appear to have fibroblastic activity. We have actually measured the amount of integrins, cytokines and growth factors which are secreted by these cumulus cells. We have seen that bucket full of these factors are secreted, which means that they are enriching the medium and enriching the embryos. Some of the embryos actually get glued to the co-cultured cells, and it is even difficult to take out the embryos from this. Finally, when we are ready for the embryo transfer, what we do is we take about 30 microliters of the cumulus cells, mix them with the embryo, and with a fine catheter, we introduce this into the uterus through the ET catheter.
Having a better success rate, what do you think are the reasons of the limited popularity of CAT among the doctors? Is it the lack of knowledge or the lack of facilities?
Well, I think CAT is a very labor-intensive procedure. It needs a whole team to set up. In our setup, we have 6 embryologists. One of them will only prepare all the plates for the procedure, all the petri dishes for the procedure. Perhaps because it is time consuming and it is also research oriented, it might be difficult for all IVF clinics to perform it. But once one is exposed to the procedure, we would see how easy it is and how it ups the success. In fact, there are 2 groups, one in South Africa who have adapted this procedure in their clinic, and one group in France. Also a group in Dubai who have used this procedure when doing IVF. And many PhD students have also looked at this procedure and used it for their thesis. So I think it needs a lot of patience. Of course, it needs financial resources. It needs the intellectual ability to be able to do this time and again. And of course, it needs enthusiasm. The writing is on the wall. It's for clinics to use it to see how they can help their patients.
So you mentioned few things. Do you think, is there any other thing that could be needed to motivate doctors to adapt to new innovative techniques in IVF or even in general?
We are very happy, in fact, to be able to hold workshops for doctors to see how it is done. In fact, when we developed this procedure, we did not even patent it. We straight away published it and put it in the public domain. So it is open to anybody who wants to use it. If a process or a procedure can help infertile couples to realize the dream, I think as doctors, we should be judicious and astute to use it to help create happiness in families.
So how do you think Docplexus is doing in promoting these new innovations to the doctors in India?
You know, I started reading about Docplexus and the good work that it is doing at least a year and a half ago. I'm very impressed with the way it conducts the scientific studies. There is no advertisement. It is pure knowledge that is imparted to doctors. It becomes a good forum for doctors to interact, and I'm very impressed that the readership has and the membership has increased from 30,000 I think to more than 120,000 today. I think you all are doing a brilliant job.
Thank you, ma'am. Thank you to hear that, and thank you for being with us. Thank you for this very insightful discussion, and I'm very sure that this would encourage our doctors to adopt new innovative techniques and try new in medicine every now and then. Thank you so much.
Thank you very much for having me on this forum.
These interviews and events are featured by Docplexus, especially for all the doctors of our Docplexus community. For receiving updates of such upcoming events, please like and subscribe to our YouTube channel, like our Facebook page, and follow us on Twitter. Happy Docplexing!